Welcome to the Pod of Inquiry, pushing the envelope for human understanding and optimization, the podcast for podiatrists. The Pod of Inquiry is designed to empower you with knowledge. What happens from there is up to you. Your host, Dr. Stephen Barrett, has designed this show to take you down some very deep rabbit holes, hopefully bringing you back out again, relatively unscathed, but cerebrally whipped, enabling a better understanding of all things worthy of inquiry. If you have more questions after the show, then that is good. The new discovery today many times was the new discovery 50 years ago, only to be suppressed or plainly ignored. Medicine and surgery can sometimes take a long while to get their paradigm shifted. We hope to have a lot of fun on this show and maybe destroy some ridiculous dogma along the journey. Thanks for joining the show today. Let's start spelunking.
It's my pleasure to introduce today's guest, Dr. Chris Estes. Chris is a board-certified OB-GYN who went into functional medicine after becoming frustrated by seeing patients who just didn't get better with the mainstream medical paradigm and sought out additional training in functional medicine. Dr. Estes is the husband of Dr. Emily Rowe, who I had on the show last week discussing Lyme disease, and that was Season 3, Episode 6. And I also had Emily on Season 2, Episode 25, where we discussed Chinese traditional medicine and so many other cool topics. Dr. Chris Estes graduated from the University of Miami Miller School of Medicine and completed his obstetrics and gynecology residency at the same institution. He followed that up with a Master's of Public Health and Epidemiology from Columbia University. Chris is an extremely bright and engaging individual who likes to tackle the most difficult cases of chronic disease and possesses one of the widest bandwidths of knowledge and expertise that you could hope to find. I know you will enjoy my conversation with him where we really focus on Eboo, extracorporeal blood oxygenation and ozonation in the treatment of Lyme disease and other chronic illnesses. I really enjoyed this conversation with him and I learned so much from him. I know you will enjoy this engaging conversation as much as I did. So without any further introduction, let's get spelunking with Dr. Chris Estes. All right, everybody, welcome to the Pod of Inquiry. I'm here with Dr. Chris Estes. And Chris, thanks for coming on the show and taking some time to help us understand this fascinating technology that's called Eboo. Before we get into that, tell us a little bit about your story and how you ended up getting to this space in medicine.
Sure. So thank you so much for having me, Stephen. It's a pleasure to be here. And I've been looking forward to this since we first met. At the conference a couple of months ago. So it's my pleasure to be here. I'm a board certified obstetrician gynecologist. I did a fellowship in family planning at Columbia University after my residency at University of Miami. Then I came back and I was on faculty at University of Miami for almost 8 years, a little over 7 years. And, I just kind of hit the wall there at the university with just the structure and the administrative things. And I wanted to change my career up. I went and I had a couple of different jobs along the way. But what really got me into the world of functional and integrated medicine was personal experiences with my wife's illness. And I know she's been on your podcast. And I think she probably shared Emily Rowe, Emily, she shared about her health journey and my personal health journey with fatigue, brain fog, and significant mold exposure. And along the way, I also found out that I had, heavy metals and, a lot of inflammation going on, a high homocysteine and all these other things. But anyway, really, a lot of what was driving me was just frustration with the conventional medical system. I worked at a tertiary care center where we had the best of the best, right?
Right.
The best cardiovascular guys. You got the top high risk OB and all these, the best urologists and the fanciest robots and, all that stuff.
Right.
And we would have these really complicated patients and they would basically just go from provider to provider to provider. And maybe they got a new diagnosis, maybe they got a new pill to take, maybe, new procedures, some more diagnostic studies and whatever else, but no one ever really seemed to get better. And I knew there must be a better way. Like there's got to be something out there. And it really, really hit home when Emily got sick and no one could figure out why. Like, why are we doing these things and she's not getting better? Why are you not responding to therapies? Why are you getting worse? Like, so that's when we went back to school and decided, well, we got to learn this ourselves.
Right. So you're kind of forced into it by just survival.
Yeah. It's funny when you talk to folks who do functional medical, almost all of us have this story where it's like, it was my health, my partner's health, my child's health, my parents, someone they knew or themselves got sick and they're like, conventional medicine is just not serving me. What else can I find? And now I always put a little asterisk on the end there. I'm very grateful for all the work I did in conventional medicine, the knowledge I gained and the experiences I had, and I still find a value in that world. It's just that when it comes to chronic medical illness, it's very limited what you can accomplish there. If you have acute problems, like if you're having a heart attack, yes, please.
Right.
If you're having a stroke, like, okay, yes, please. If you need to be in the ICU, okay, cool. They'll save your butt in the ICU.
Right.
But when it comes to long-term chronic medical complications, or chronic medical problems or wellness, like, well, I don't have a diagnosis yet. I'd like to not have one. So what do I do to keep myself from developing any of this sort of stuff? And that's really what got me into doing functional medicine full time. And I realized, even before I was formally trained, like through Institute for Functional Medicine or my training with ILADS, my training with Neil Nathan, and doing classes with people like, I did shoemakers training, I did, training with Richard Horowitz and all these different folks in the world, and of course Dr. Schallenberger for ozone and all that stuff.
Right.
Even before that, I was really doing a lot of functional stuff without even realizing it or calling it that. Because of all things, the other thing I was known for at University of Miami was I was good at office gynecology, particularly when it came to chronic vaginitis. So like women who would have recurrent yeast, recurrent bacterial vaginosis, like these just infections that wouldn't quit. Like they'd treat them the usual way and they come right back. I realized early on that if you treated their GI symptoms, the vaginal symptoms went away. Which is like a cornerstone of all functional medicine work, right? Like treat the gut first, and I found that most of the patients that I was getting referred were horribly constipated. So like I was just giving them stuff to like, well, that's not good. Here, let's fix your constipation and we're going to treat this and this. And I learned some other tricks, some other things to use that were unusual medications or unusual approaches for BV and yeast. And I realized at the end of the day, it's like, wow, really what fixed the problem was fixing their gut. And then the vagina magically takes care of itself. But anyway, so that was my foray into this.
I've heard that story from not only yourself, but many other people that are in the functional medicine space. And the way I looked at it personally is that, we're dealing with peripheral neuropathy, which is a very complex situation. And most of the time when your mainstream treatments don't work, then you have to either say, well, sorry, I can't do anything more for you, or you need to start picking up rocks and thinking about, well, what else is going on to make this host susceptible to these neuropathic symptoms? And so you almost get forced into it if you are ultimately caring about the patient outcome. And then, by taking this functional integrative approach and marrying that with, say, with your background in obstetrics and gynecology, what a hybrid that is.
Yeah.
So
it's cool. I mean, I've met a good number of other OBGYNs that have gone this way. Many of them, got into it through the door of learning about bioidentical hormones. Others, through like osteoporosis management and stuff like that. But at the end of the day, you realize that all of it relates in the same way. Like it's all sort of a similar approach, and each of us develop our own little niche. My niche is a lot around toxin exposure, detoxification, and chronic infections. And for some reason, I just seem to attract GI stuff. Like that seems to be something that shows up a lot in my practice for some reason, and I have good success with those cases too. And I've learned a lot through the years about how to manage those things.
Yeah, well, they say, like you said in the beginning, all things begin at the gut. So it's pretty hard to make the patient better if they've got a toxic, leaky gut, and all of this re-exposure. Not to mention the toxin load that almost everybody has now just from living in our environment. It's amazing we haven't killed ourselves off just yet, but we're in the process of doing it. That's for sure. So let's talk about Eboo. And tell us what Eboo stands for. And
sure.
It sounds like something you'd say at Halloween or something. Eboo,
Eboo. It's the latest one. It's on the phone. Eboo, right?
Yeah, right. Yeah.
So Eboo stands for extracorporeal blood ozonation and oxygenation. I've also heard it referred to as ozone dialysis, which kind of makes sense when you look at what we're doing, although it's not a true dialysis procedure.
So they are using dialysis technology during the process, and we'll talk a little bit more about that because I've got some questions on that. But so Eboo, I would imagine it's really now starting to catch on in the integrative functional world. It's a pretty hot topic right now, but I imagine it's been around for a while. Historically, when did they start and where? I think it was Europe, right?
Correct. So the story that was related to me in the lore of medicine. I love history of medicine too, by the way. I mean, when you look at how things develop, I love learning that. And the history, so far as I understand it, began in Italy, and they were searching for treatments around childhood leukemia or lymphoma, something like some childhood malignancies. And the first experiments began in the 1990s on sheep, because apparently their circulatory system is quite similar to ours. Now, I love basic science, but I'm not basic science-y enough to explain that, but apparently that worked. So they figured out, okay, this is the safe range to do these things. And then the researcher himself, who was originally doing it, I'm really upset at myself, I can't remember his name.
Was it Bocci?
Yeah, I think that's correct. Yeah. So I like to give credit where credit is due.
Yeah.
Did the procedure on himself. So the story goes that he tried it first, which I respect that. And
sounds like the H. pylori guy.
Exactly. Yeah. A little. Well, at the time, you didn't know, is this gonna hurt me? Is this something terrible gonna happen when I do this? You don't know.
Right.
And he lived and said, hey, that felt pretty good. So they started, playing with, well, how long do we run the machine? What sort of, dose of ozone do we use? And then the technology actually really took off in Southeast Asia, particularly in Malaysia. And they built the next generations of the machines there. And I believe some of the early research was looking into whether or not you could treat HIV with it. As it turns out, it does not eradicate HIV. I mean, what a wonderful thing if it did.
Right.
However, what they did find it was particularly good at was people with cardiovascular disease got better. People with chronic wounds got better, like diabetic foot ulcers that weren't healing, like they do Eboo, and their foot ulcer got better.
Right.
And it wasn't even what they were going for. And they're like, whoa, we're on to something here, right?
Right.
So cardiovascular disease, inflammation markers around cardiovascular health, chronic wounds, ulcers, and then, of course, immune health in general seemed to improve. And that was beginning in the early 2000s. And people developed protocols around, what's the appropriate level of ozone to do? How often do you do it? What are the right filters to use? That's really, really, really important. Because when you deal with ozone, ozone is an oxidizing agent. It is a reactive gas.
Right.
So you have to be careful what you expose to ozone. Like if you take like a regular nitrile or latex glove and you blow, if you've ever seen those videos where they blow ozone over the top of a glove, it'll eat the glove.
Wow.
Like it'll just disintegrate.
Right.
Latex tubing, many different kinds of plastics, certain metals even will corrode in the presence of ozone, and depends on the dialysis filter you use. So there's a specific type of dialysis filter that we use where the plastic filters that are in the dialysis filter, because when you cut a dialysis filter open, it looks like thousands of little hair, basically. It's like a bunch of little hairs. You have to make sure you use a plastic that's actually doesn't degrade when you expose it to ozone gas. So the specific dialysis filters that are used for this are made from a fiber that doesn't degrade in the presence of ozone.
So just from a general setup, I want to come back to the physiology a little bit about this. I actually, before I go to the setup, let's talk about your experience. When I'm pretty sure you probably had a pretty good grasp of MAH, or major autohemoinfusion, with ozone. And you just mentioned before we came on that you actually have a patient now that you're doing, a multiple pass treatment on. So I think that's great. So when did you start in ozone, and then how long did it take you to evolve into the world of Eboo?
Great. Yeah, that's, so the first thing I did learn was MAH. And I trained with Robert Rowan and Frank Schallenberger to learn their techniques and learn their approach, and I settled on using the multi-pass treatments with the Zotzman stall machine. I feel like that was the most versatile and best machine for the job and was an approach that I liked. I started doing that in about 2018 or so.
Okay.
About
all right.
5 years ago. And Eboo was coming on the scene shortly thereafter, really. I mean, they've only been in the United States. That is, like, I don't know when the first machines showed up in the United States, but it was around that time, 2018, 2019. And I was, hearing about it, and, some other people were talking about it, and they're like, oh, you got to go to this clinic down in Mexico to get it done, or there's some places in Europe, or, you got to go over to Asia, and you can get the full procedure. And then finally people brought it to the United States. And I did a lot of research. Like, I talked to the folks that make the machine in Malaysia. I talked to the folks that, have kind of a cobbled together machine where you use, a pump from this, you use a different ozone generator, you use a filter here. And then I talked to the people that make the device that's called the Stratos machine. Stratos machine is a purpose-built machine that's basically the same as the original Malaysian machines, but it's manufactured here in the United States. So you don't have to worry about getting it shipped from overseas, and it's purpose-built here in the United States. And I decided on that machine after literally a couple years of research, because for me, patient safety and reliability of a machine, and the actual, integrity of the company making the machine, to me, is number one. Like, I'm not going to use a device that's like, oh, we just started manufacturing this, 2 weeks ago, and it looks like it works pretty good. I'm like, okay, you can play with that for a while. Call me back in a year and see what happens, because, in the world of medicine, things come and go. And like, I want to make sure it really works and that it's safe and effective. So, which is part of the reason why I bought the Zotzman machine originally. I mean, they've been making machines for decades, and, the basic design hasn't really changed that much, because it's just a good, solid machine that's very, very safe and reliable. But anyway, when we decided to try it, we were interested in it for our own health as well. So we flew out to Scottsdale, to Angie's clinic in Scottsdale to get a treatment, see what this is all about, see if we liked it. And, both Emily and I did a treatment, and we were like, okay, this is good.
You could tell the difference. You could feel it.
I felt it immediately.
Yeah.
I felt it during the treatment. I mean, during the treatment, about 10, 15 minutes in, nice, relaxed, light feeling, brain, much clearer focus. I still do have a bit of a brain fog / you would guess we'd call it ADD kind of picture, where, I have, like, some trouble multitasking, and concentration and focus could always be a little bit better. So that's where I can feel my symptoms the most from my history of toxic exposures and stuff. So, like, I could feel that, like, get better during the treatment.
So, Chris, let me ask you, so you've been comfortable in the ozone space with MAH, and now we're going to evolve into Eboo, and you're still using Ozonation MAH without Eboo. So break that down a little bit. How do you decide when you want to integrate Eboo versus just your regular ozone treatment? And then let's talk about the differences. Maybe what does Eboo do versus something that ozone doesn't by itself?
Yeah, that's a great question, because, like, they're both excellent technologies.
I
was getting great results doing multi-pass treatments, whether it was 2-pass, 4-pass, or 10-pass, depending on the patient's tolerance in their particular situation. I was getting great results with that. Like, well, why would you do this too? So, the data on which one's better for what, I think there's a little bit lacking. There's no head-to-head trials. So, I mean, we're going on clinical experience. There's a couple of things that I feel like Eboo is a little bit superior for, and it has to do with the filter.
Okay.
Because in the regular MAH, your listeners probably know, we draw the blood out either into a bag or a jar, expose it to the ozone, put it back in. So the ozone does its thing in the blood and activates the lipid peroxides, and you get all those downstream effects that are helpful on.
Right.
But you don't get a filtration. So in Eboo, we start an IV on one arm, the blood runs through a pump, okay, and then it runs through a filter. And inside that filter, it's the same filter we use as dialysis. Inside the filter, the ozone is applied through it. So two things happen with that. Number one, if you can imagine taking your blood and putting it on a piece of paper,
right,
and then blowing over the top of it, spreads it out.
Okay.
So you're going to expose more red blood cells to the ozone than you will in a bag or a jar, because it's just more surface area, like by a logarithmic fold. I don't know, I couldn't tell you how much, but I mean, it separates your blood cells out, so you're actually going to get much better exposure. Number two, the way that we deliver the ozone in Eboo is different. In MAH, you're getting a pulse, you're getting a blast of relatively higher concentrations of ozone, anywhere between, what we call 20 gamma at a very low dose up to like 70 gamma at a high dose. Whereas with Eboo, we're going to expose the blood to 3.5 or 7.0 gamma.
So that's real low gamma compared to your traditional ozone MAH.
Very small.
Right.
But it's a continuous exposure.
Okay.
So it's always running. It's always running. Now we have control over it. So if we see that, we watch. So we look and see, is your blood making a nice color change as it's going through? Are we getting too much debris over here? Are we getting foam in the little fluid collection device that would be a sign of denatured protein in your blood? Are you starting to feel badly during the treatment for some reason? We can turn the ozone off and just let it run with oxygen. Okay. Most people tolerate this really, really well, and most people do great with it. And we can vary that dose of ozone depending on the patient's tolerance level, their disease state, how many treatments they've done. The timing of the procedure is also pretty standard. We usually run the machine for about an hour, the whole from start to finish. It runs for about an hour. And we're going to filter about 3 liters of blood, give or take.
Okay.
It's different for every person because it depends on how fast your blood flows, how much fluid we need to add to the blood to keep it flowing. When you think about the amount of ozone you get exposed to, it's actually substantially larger total amount of ozone that you're going to get exposed to versus a 10-pass MAH. People have done the math, and it's like several fold greater. But that's because you're getting a low dose of ozone constantly. So if you were to measure, like, well, how many milligrams of ozone pass through that filter versus how many milligrams am I giving you in this bottle, there's actually more ozone in the Eboo.
Okay.
But what I've found in my and I've talked to other providers about this, and everybody feels pretty similar to this, is that the Eboo is actually a smoother ride than a 10-pass treatment.
Okay.
Even though it's more ozone. Like, people with the 10-pass treatment will tend to get a little bit more shaken up. So like a little bit more kind of detox reaction, Herx reaction, a little bit more fatigue or soreness the next day, as opposed to Eboo, where there seems to be less of that. Because of the nature of the way we're delivering the ozone. I don't know if anyone's really seen the physiologic reason for that, but I can tell you from clinical observation, seems to be that Eboo is like a little bit smoother ride for people. And the one, this is kind of, again, we're going a little bit around the corner here.
Right.
The filter, I think, is a big part of that. not just because it opens the blood out, it spreads the blood out, so you're exposing more blood to the ozone, more blood cells get exposed to the ozone, but that filter is catching the stuff. Like,
right.
things will stick in there. That's been looked at as well, and that data was presented, at ozone conference and stuff, and all sorts of things come out. I mean, biofilm, microorganisms, fragments of fungus, toxins, and the amount that comes out it's interesting. And we always like to look at the end. It's like, what's the prize in the Cracker Jack box? It's like, what's in there?
Right. What do we get today?
What do we get?
Yeah.
And I've seen some interesting things. Like, people with chronic infection, I'll often see literally little chunks of stuff. I mean, it looks like a little fleshy crystal.
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor. Several years ago, I chose Alpinion as my ultrasound brand of choice after years of experience and research into ultrasound imaging. In fact, I have 2 of their machines. Alpinion has incredible precision and penetration built into their technology that, in my opinion, is simply the best value in all of the ultrasound imaging space. They have several price points to meet your needs, and I can tell you definitively that you'll end up having to pay double to achieve the equivalent imaging quality from other top brands. That doesn't even account for the unlimited software updates and remote tech support included with no monthly fees. Right now, to show their appreciation for the listeners of the Pod of Inquiry, they're offering an incredible discount. Their portable i7 retails for $21,000. But you can get it discounted at most medical meetings for $19,000. But my listeners will get it discounted to $15,900. This has never been offered anywhere for the new portable system with the engine of a console system. Use code SBPOI to take advantage of this incredible offer. You won't be disappointed with Alpinion. I sure haven't been.
Yeah, Emily had an impressive amount that came out. I mean, you looked at her filter and it was full of junk. I mean, you could just see it. I've had little bits for me. Other people will stain the filter. I had one guy we've done Eboo on many times. He was coming for asthma. Actually, he had chronic asthma. He's otherwise a pretty healthy guy, but he's like, well, I really want to tune up. I want to feel better. I don't want to have to use my inhaler.
Right.
Since he's been doing, he alternates back and forth between doing Eboo and 10 passes. Hasn't used his inhaler in over a year. I mean, amazing. No meds, and he feels great. But anyway, one time he's an auto mechanic by trade, and he owns auto body shops.
Okay.
So talk about a toxic exposure.
Right.
And he's been doing it for years. So he's working around oil, petroleum, welding, One day we did his procedure and there was a brown black streak through the whole thing.
Oh,
I mean, I don't even know what it was.
So let me interrupt you there for 1 second, because I think this is very interesting. The filtration may be one of the integral differences then, in your opinion, between the 10 pass and Eboo. As you're going along with these treatments, the patients are improving. Do they have less gunk in there as you go on? Do you see a cessation of gunk accumulation?
That's it's so funny. Sometimes it's more.
Okay.
The first treatment, you get nothing. Second treatment, you get a little. Third treatment, you get a lot.
Okay. That's a little counterintuitive.
Totally. And no one seems to be able to explain it. I can't explain it. I think what it is, the body has a particular intelligence that's far beyond what any physician can comprehend. So I think ozone and these technologies are harnessing the power of one's own ability to heal. At the end of the day, that's how it works. So your body gives what it's prepared to give, and what it's prepared to get rid of, what it's prepared to do, what layer is ready to be taken out that day. The other thing we look at too is there's fluid that comes out. There's this excess inflammatory fluid that will come out of the filter that it should be perfectly clear. And basically it's just extracellular fluid that's excess inflammatory stuff. Typically we'll get 150 cc's or so.
Okay.
But every now and then you'll get like 300, 400. My record so far is 650.
And that's just it's like a serous type of.
It's clear. It looks like water.
Okay.
Literally looks like water. It's just clear. It should look like water. If it's brown, now this is another thing I'd like, if you see in that that water that comes, that fluid that comes out, that kind of effluent, excess extracellular fluid, it should be clear. If it's brown, that's actually hemolysis.
Okay.
So a little bit of hemolysis with ozone is not unusual because,
right.
exposing ozone to red blood cells to ozone, some of them will lyse. If you're getting excessive levels of hemolysis, the fluid will start to look brown. That's bad. That's when you say, okay, this person
shut it down.
Go to oxygen only.
Okay.
You go to oxygen only, it'll stop.
Okay.
Or if it just really doesn't stop, okay, stop the procedure. Stop the procedure. We finish off whatever's left and we done. The other thing that you'll see in these filter that comes out in this fluid is it's sometimes foamy, and people have looked at the foam, and the foam is actually denatured protein. Just like, if you think, well, it's easy to think of it like, well, why does that make sense? Like, well, people with bad proteinuria, right? When they pee, like foamy urine, like the urine's foamy like crazy, right? So when there's excess denatured protein in that effluent fluid, you'll start to get foam. You'll even see some places that advertise doing Eboo, and they're proudly holding up their effluent stuff here, this fluid that's brown and foamy. Like,
right. Yeah.
That's bad.
Yeah.
That means they gave you too much ozone, because there are folks out there doing Eboo that are using Eboo on the principles of MAH, and they're giving too much ozone. So like, you can't do Eboo at 20, 30, 40, 50 gamma. You don't.
Right.
You don't need it. So like, if you give somebody, high levels of ozone while you're doing Eboo, the blood will hemolyze.
Well, let me ask you a question too. Are you heparinizing these patients before their Eboo?
So what we do is there's an inflow line. So as the blood comes out, it'll go to the pump. Right before the pump, there's an inflow line.
Right.
And the inflow line, we drip heparinized saline.
Okay.
So we'll put like 7,500 units of heparin in the bag, 500 cc bag, and that slowly drips in. Most patients will use that 500 cc's, so they'll get about 7,500 cc or 7,500 units, I'm sorry, of heparin during the procedure. Some don't even use the whole bag, so they'll get like 5,000 units of heparin or so. But we use the heparin it just drips in during the procedure.
Okay. And so, I know with MAH, sometimes when you're trying to put the blood back in, you might have to flush the line with a little bit of heparin so that you can get it back in without a clot. And, but
this is interesting though, because of the nature of the flow, it doesn't seem to happen so much, because the pump is basically just a circular rotary pump. So the tube goes through, and there's like a little rotary thing here, and it pulls the blood out like a pulse. When you watch it come out, the blood literally, when it's really cool, because when we set the system up, we set it up with heparinized saline, so like it's clear, everything's clear. And as the blood starts to flow through, you see this beautiful like little waves of blood coming through. It looks really neat, and you'll see it flow like a pulse. And it'll start off at a rate, and then you get it up through the filter, and then when you connect it to the other side, it looks like it's the drips, and like the circuit speeds up a little bit. It's like, okay, now the blood's coming back. It's like my body intuitively knows that I'm not trying to bleed it to death, and like it flows so nice. And I've had this too with folks who I can't do an MAH on because I just can't get the blood out of the vein. Like, it doesn't tolerate the suction, or it's really difficult to get it. It won't flush, it won't flow, whatever. Those patients actually I have found do well with Eboo because of the nature of the way the blood is pulled out in that pump and the circuit. So I've had people who couldn't do a regular MAH, and they did an Eboo and did great.
So it correlates more with more of the natural hemodynamics of the arterial or the venous system.
I think
maybe.
so.
Yeah.
I think there's something to that.
Yeah.
Because it's a complete circuit, and it's not, because when we're doing an MAH, if you're doing the old school bag MAH, you're just letting gravity pull it down. But if you're doing a multi-pass treatment, it's a vacuum. You're sucking it out. This
Right.
isn't really suction. This is a gentle pulse. So
All right.
it seems to be a little nicer.
So in addition to the filtration, is there anything else in the Eboo system? I mean, obviously you're getting better ozonation, even though at a lower dose. So I think that has probably a lot to say. What I was going to say is that you mentioned, that you've treated some diabetic foot wounds or diabetic ulcers or wound compromise, and that it enhances the peripheral arterial system. And we know that ozone, through its mechanisms, works on the RBC to basically work on heme oxygenase 1, and so it's that RBC is able to get more oxygen ultimately to its target destination. It seems like Eboo might be even much more than an MAH, just because of what you said with the filtration system, the way it's you're basically covering more RBC surface area in and of itself.
Exactly right. You're covering more RBC surface area strictly. In an MAH, with the 10 pass treatment, we'll put what 2 liters of blood. Right. Granted, it's some of the same red blood cell might go through that bottle more than once, because I take it out, I put it in, that blood cell is going to go back around your body and go through, but it's 2 liters, right? The Eboo is estimated to be around 3.
Okay.
Some people, it's probably even more. And because of the way that's the filter works to increase the surface area of exposure, yes, it seems that we're going to hit more red blood cells with a more efficient dose of ozone. Part of ozone's principle of operation too is hormesis. So, that whole idea of what's the right dose? It's there's like no effect, good effect, too much, toxic effect, then there's another peak, another peak. So that hormetic effect may also be coming into play there as well. Is it's the right number of cells for the right amount of time at the right dose of ozone.
So from a physiological standpoint, just for the audience, want to go over a little bit. So we know that ozone primarily gets degraded very quickly in water or plasma. And then a big constituent is the hydrogen peroxide. Hydrogen peroxide might be the muscle man in this whole story. I don't know enough about, the intricacies of some of the other physiological effects, but it seems like the hydrogen peroxide is really delivering a lot of the different actions. And in the RBC, we know that it works on offloading this oxygen to the target destination tissues. In leukocytes and endothelial cells, it works with upregulation of different cytokines, interleukins, interferons, growth factors, even nitric oxide. And then on the endovascular, the endothelium, it has kind of an interesting in that it seems to work differently even though they're all very similar, but it's kind of like they're different participants, and they respond just a little bit differently to the hydrogen peroxide or the peroxidases, however you want to term it.
Sure. Yeah, it's beautiful, right?
Yeah, yeah, cool. Yeah. Well, I remember Dr. Schallenberger saying there's no disease that can't be improved with ozone. That so it's not maybe going to cure everything or be the end all be all, but it's certainly going to augment just the natural physiology of a human.
Yeah, that's what I tell people. Is ozone is not a cure-all. However, it makes whatever you're doing work better. So whatever you're doing, it's going to work better if you add ozone on top, as long as you're a good candidate for ozone. Right. You don't have G6PD deficiency, you didn't, just have a stroke yesterday, as long as it's medically safe for you to do and you tolerate the procedure well, it's going to make anything else you do work better. I stress that to people. Like you can't expect to cure your Lyme disease with 10 past treatments.
Right.
You can use 10 past treatments to help your Lyme treatment work better. And do we get better? Do I think we get better success treating something like chronic Lyme or BART or whatever, Bartonella, any chronic viral stuff? Oh my goodness, like it's so good for chronic viral things. Yes, we definitely get better results if people do that. And I'm upfront with them about that too. I'm like, look, we're going to do all this stuff to help your chronic infection, whatever it might be. But if you really, really, really want it to work, I'm like, go this extra mile and you'll be glad you did. Because 9 times out of 10, I find that it's super helpful for those patients.
Explain the G6PD a little bit to me, because I know that that's also a pretty significant consideration in vitamin C infusions.
Yes, absolutely. So G6PD stands for glucose 6-phosphate dehydrogenase. G6PD is a normal enzyme that everybody has or should have. There are genetic conditions where folks are born without sufficient levels of G6PD. The classic board question about favism, because if you eat too many fava beans and you have G6PD deficiency, you can actually develop hemolytic anemia. And that's the complication, because if you have a deficiency of that particular enzyme, your body doesn't handle oxidative stress appropriately. In other words, the oxidative stress doesn't get broken down quickly enough, and it starts to build up. And those reactive oxygen species, like the lipid peroxides and hydrogen peroxide and those things, they build up, and that then starts to damage the red blood cells, and the red blood cells will lyse. Hemolysis.
So it's a hemolysis thing that we're trying to prevent primarily with G6PD. I think I recall someone, it might have been a podcast I heard with Nathan Goodyear on some of his cancer patients. And I may be totally wrong on this, but in cancer, that G6PD is actually upregulated in many cancers. I didn't know that.
I didn't know that either. I mean, certainly these things are dynamic. What I was going to mention, not about upregulated, I'm going to look into that, because maybe I could see that, because like for a cancer cell, that would be a protective mechanism.
Right. And
if you had more G6PD, you would actually evade my high dose vitamin C. Actually, if you had a higher G6PD, you could also evade my radiation. Because that's how radiation works. Radiation works on oxidative stress. So if a cancer cell had upregulated G6PD, oxidative treatments might not work as well. But the other interesting thing about G6, and I'm gonna have to look into that. That's a really interesting thing to think about. The G6PD deficiency can actually be acquired as well. Classically, it's known as like a congenital thing, where it's like, it's genetic, but certain types of infections, I've seen it, I believe I've also seen it described with malignancies, where your G6PD becomes deficient and it's acquired over time. So I always check it on everybody, because even if you were okay, 10 years ago, if you haven't had ozone in 10 years, I was like, well, and you've had some sort of significant medical issue, please, let's make sure it's normal. It's a simple, inexpensive blood test, that can keep you out of serious trouble. Because if you do an oxidative therapy on a patient with G6PD deficiency, it's like you could wind them up in the hospital. So it would be a very rare complication, but it's a simple one to prevent.
Let's talk about combination or amalgamation of care, right? So we have Eboo, and let's say we've got a heavy metal issue as well. So are you concurrently running chelation therapy with your Eboo? And maybe give me a kind of what your indications are. So what's
absolutely.
That'd be great.
So let's start with toxin. Toxin's a good place to start. So Eboo is, MAH is great for helping support detoxification as well. Helps all your organs of detox. So how could it be bad? However, I do think Eboo in a way kind of nudges it out a little bit superior, just because of the filtration, particularly heavy metal. And what we'll do is give a low dose of chelation. You don't give a full dose. We give small dose of chelation. IV. I use calcium disodium EDTA. I suppose people could use other chelating agents if they wanted. We do a small dose of chelation IV, and then 2 to 5 days later, do the Eboo. And what's really fascinating is that this low dose of chelation seems to kind of shake the tree, like get things ready to fall off. And metal levels improve quicker and people's symptoms improve quicker if you do the chelation plus Eboo. That actually comes from research in Malaysia, where they developed that protocol, where they were doing chelation plus Eboo. That's where it was first developed. And I've started implementing that in my office too. I tried it on myself once because I had a history of heavy metal toxicity myself. And my latest levels were below detectable or below,
normal, supposedly. Yeah.
Oh, normal.
Right.
Exactly. Yeah. Normal for 2023, where we're exposed to all this stuff. Anyway, not in the red, so I mean I had a little trace of that, but it's like in the green over here, like not of a concern. Whereas before I was like, whoa, like that's a lot of platinum you got in your urine, Chris. You should really be making jewelry with that stuff, right? Like,
you're right.
Impressive.
Yeah.
Like chill out on the fish, man. Like, whoa, mercury.
Yeah.
So anyway, so I my testing was better, and I had done Eboo a couple of times just without the chelation, and then I said, let me just try this. Let me see what it's like. See if it makes a difference. So I did a chelation, and then a couple of days later I did my Eboo. And, I got my usual nice feeling during Eboo. It felt good, nice and relaxed and, clear. And then the next day I was out on a walk, and, my wife and I were going to feed the ducks. We like to go feed the ducks and the pigeons and whatever. So we're out feeding the birds. And all of a sudden on my walk, I was like, whoa, I am wiped out. Let's go home. Okay, fine. No problem. Drink some water, sit on the couch. I was fine. But that session definitely hit me different than the other ones. So exactly what I was feeling that day, I can't be 100% sure, but it definitely was a stronger treatment. As a matter of fact, I was supposed to go diving the next day.
Yeah.
I was gonna go scuba diving with my buddy, and we were gonna go for lobsters and spearfishing. And I called him up. I was like, dude, I'm detoxing here.
Yeah.
I don't think I should dive tomorrow. I'm like, I think I'm going to be fine, but I'm like, the last thing I need is to go underwater,
right.
Feeling like this. So, but then the next day I was great. I probably could have gone diving. But like adding that chelation in there definitely did something. Granted, once I had my dip, and this is the classic ozone. It's like, well, you get a little dip and then you get better. And I had my dip and then I got much better.
Yeah. It's so interesting because there's so many things at play with these patients. Rarely, Emily and I had a great discussion on Lyme and its co-infections and how it's rarely just the simple. The patients that are coming to see you are not the simple, right? Because they get taken care of. They're all pretty much filtered out, no pun intended. Now that we're talking about filtration, but they're all filtered out because they get well right away. But the folks that don't get well have these multiple, MSIDs, all of these very detrimental things that just add up. And it's like heavy metal exposure, right? Rarely have I seen when we test, do they just have one? It's always three. They're high in lead, they're high in mercury, they may have, some other thing going on, but it's pretty, I think I'm excited about Eboo. I've been looking at it for about a year now. And the more I hear about it, the more applicability I think it has, provided it's done with professionals like you that know what they're doing,
Anybody who knows how to do the MAH, anyone who's familiar with doing those sort of procedures, they could easily learn how to do Eboo. Me and my staff, we actually love doing Eboo because it's actually easier than MAH.
Right.
But once you learn how to set up the machine, it's a little bit of a setup. You got to know, okay, this tube goes here, you flush this way, this goes here. Once you learn the mechanics of the machine, that's one other reason why I love the Stratos machine. Like, so for our listeners, like, please go to someone who uses the Stratos machine. I have no financial connection to these people. I just like their device, and it's the right device.
Right.
Because if you don't use the right device, you can actually do this the wrong way. So, like, not all Eboo is created equal. So you want someone who's using the right machine that knows how to do this. So once you get it set up and it's running, it's like kick
Hands
back and
off. Yeah.
kick back, have a conversation, and just chat with your patient. As opposed to, like, when I'm doing an MAH, I'm like, it's like a little dance. Like, I'm like, I'm pushing my button, I'm doing this, I'm doing that. It's like, not
Right.
that it's, once you learn that, you can do that too. But the Eboo is a really smooth ride.
What's one of your grand slam cases with Eboo? Because I love to share with the audience different case illustrations. What's one that comes to mind?
So that guy I told you about with the asthma was pretty impressive.
Right.
I mean, he was using his inhalers on pretty much a daily basis, and now he hasn't used a puff in over a year.
Wow.
And that he stopped using his inhaler after 2 Eboo treatments. He's been keeping follow up with me, and like literally just fine, and everything else in his life has gotten better. That's one that I can think of right off the bat. Other ones I've seen really significant improvement. I've had a couple of patients with Lyme, that Lyme and mold. It seems like, I don't know, these days I have a single patient that's got Lyme MSIDS that doesn't have mycotoxin exposure. Maybe it's just because I really look for it, and
Right.
we live in South Florida, so it's like super moldy. But I've had a couple of those patients who came in who just weren't responding to other things and have really taken off. Actually, I just had one lady who was diagnosed with optic neuritis.
Wow. Okay.
And was having all sorts of neurological symptoms all over, like couldn't lean forward because she would pass out. I mean, and it was all neurogenic. And I mean, she was hospitalized a couple of times. I saw her for the first time a little over a year ago now. And I diagnosed her with mold, metal, Lyme MSIDS, including Bartonella. Okay. And I began her on a whole protocol with supplements, herbs, meds, antibiotic regimen. And we started with multi-pass treatments.
Okay.
We were doing, for her, I think like 6 pass, because anything at first we couldn't even, we were doing 4, because when she did 4, man, she felt it. Like, she was like, whoa, okay, I need a day off after I do my ozone. And I was like, okay, 4 is good.
Right.
Let's keep you at 4. And she did that, consistently for probably about 6-8 treatments. And then we did that throughout her antibiotic course. And then I look at Eboo in these patients like the cleanup crew.
Okay.
It's like, okay, I know antibiotics have a toxicity. I know a lot of this other stuff I've been doing. We've been really doing some heavy duty detox. Let's finish up here and clean this up, right? So she came, and she's now done a couple of Eboos with us, and like, she was already doing much better. Like, symptoms almost completely gone, energy level much better. She had gone, she has a very active physical job that she sometimes has to travel for. And she traveled to a place that was very hot and desert-like, and did fine. And she was like, a year ago, she's like, there's no way. She's like, I couldn't have even gone. She's like, I could have barely gotten on the plane. Okay. But all these treatments together finally put her up there. And like I said, and I think the Eboo for her is going to be the icing on the cake. She's done 2, and in both times up. She described the same thing. She was like, yeah, I feel great, but I didn't get the dip. She was like,
so maybe that smoother dosage of the gamma,
Yeah, I know. I have seen people, like I said, even me. I had my dip with an Eboo, though it doesn't seem to happen every time, because the next one I did after that, I was fine. But I don't know. It's one of those sort of things where it just depends on what's around and what's ready to come out. But yeah, I think for patients that have got these really complex problems, to work Eboo in as a part of the treatment, whether it's right up front, to kind of get the program started, because I've done that too. or on the back end.
Mm-hmm.
I do kind of like the MAH for its antimicrobial capabilities.
Okay.
It seems like it's a little bit more of like a kill the bugs sort of thing.
Okay.
You know?
No, that makes sense. Well, Chris, this is fascinating. I can't tell you how much I love talking about this stuff because it actually makes people better. And that's a great thing when you can do that. Tell people how they can get a hold of you guys down in South Florida if there's somebody they want to send a patient down to, or they may just want to go down and have Eboo themselves or something.
Oh, absolutely. So our website is www.miamibeachcwc.com, as in Comprehensive Wellness Center. That's the name of our clinic, Miami Beach Comprehensive Wellness Center. Our phone number is 305-397-8229. If you're specifically interested in Eboo, ask for an Eboo consult.
Okay.
Or ozone. If you're interested in doing MAH, ask for, doing an ozone consult, and they'll book you for a consult with me. That's our standard. We do a consult with everybody before we start. Depending on the level of the complexity of the person, if it's someone who's just like, well, I want to do this for longevity because it's great for longevity, I want to do this just for energy, I want to do this as part of my maintenance, or I had these things in the past and I just want to continue my treatment, it may be very simple. If it's someone who has a lot of issues going on that doesn't have a plan, obviously, things will be a little more complicated. And then we take a look at your labs, your past medical history, see if there's any holes that we need to fill in, order the labs, and then we can get started.
Sounds great. Thank you so much. I really appreciate your expertise and passion, and it's wonderful.
It's my pleasure, man. Thank you so much for having me on. It's a pleasure to talk with you.
Well, folks, if you are over 40 and you are not using a supplement to augment nitric oxide production, you should really think that. This molecule is absolutely imperative to health, not to mention its cardio protection. If you have any question on nitric oxide, I suggest that you go back and listen to the Pot of Inquiry, Season 1, Episode 3, for my conversation with one of the world's experts, Dr. Nathan Bryan. I never miss a day of nitric oxide supplementation. That's how important I believe it is. Long overdue, there is now a nitric oxide replenishment formula without the fear of oxalates. Approved Medical Solutions does not use beets, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBARRETT, all lowercase, at checkout, and you will receive a 10% medical discount savings. For licensed practitioners, go to approvedmedicalsolutions.com and register. They have unique bundles for all of the full-fledged spelunkers of the Pot of Inquiry. Use Pot of Inquiry at checkout after registration, and I'm certain you will be pleased not only for yourself, but all of your patients. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see every one of those patients will be nitric oxide deficient. When they see this result, they will want you to start them up immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates.
We hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes, found at our website, potofinquiry.com. If this incredible and educational conversation has tickled just a little bit of your cortex, please leave us a review and spread the message to your friends and colleagues. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pot of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pot of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.